Okay. Yeah, I see in the participants, we have quite a few on, which is terrific. Okay. All right. So then I am going to kick us off, and I am going to say a big hello and welcome everybody to the Women's Bipartisan Legislative Caucus webinar today. And for those of you who are not familiar with us, we are the women elected officials to the House of Representatives and the Senate, both Democrat and Republican women. And in addition to the work we do around legislation, we also are focused on providing education to the public, education to ourselves as well as elected officials to make us better elected officials for our residents, but also want to share the information we have so everybody understands what's going on in our state, what the impacts are. And through that process, we have been hosting a number of webinar sessions. Last couple of weeks ago, we had the Women's Business Development Council on, and they talked about the statistics regarding women-owned business and minority-owned businesses in Connecticut, and the percentage of women-owned and minority-owned businesses that received assistance through the CARES Act, which was less than 20% for women, less than 10% from our minority-owned businesses. And we provided the resources to help those women-owned businesses. And today we are going to hear some more startling statistics. And we are happy to welcome Jennifer Stedman, who is going to talk about the collaboration between the funders and member organizations of the Connecticut Collective for Women and Girls in the Connecticut Data Collaborative. It's a mouthful, but I got it. So the collective focused on the impact that COVID has had on women and girls, in particular women and girls of color, and that impact around healthcare, family assistance, domestic violence, economic security, a lot of significant issues, and a lot of disadvantages that we have seen over the past year. So we're very appreciative of the work that the collaborative has performed. We value the work that you've done, and we're so grateful that you're going to share that analysis and those results in that report with us today. I want to also acknowledge my co-chair, Rosa Rimbimbis, who is my partner when we host these webinars, but I know that she is in another committee meeting at the moment. She's actually, I think, running that committee meeting. So she's going to join us later on if that committee meeting ends before we are finished. So just a couple of things before we get started. There's going to be a presentation, but you are welcome to ask questions through the chat function. And there will also be a Q&A at, I think, at the end of each section. So is that right, Jennifer?
I think we're going to do all the questions at the end, so we can sort of get through all but you can put them in the chat and we'll make sure that we get to all of them.
Okay, awesome. Okay, and before I introduce Jennifer, I just want to give a shout out to everybody that has worked on this project, because I know Jennifer is our key spokesperson, but it's a collaboration through a lot of hardworking women and men. And I want to also give a shout out to Sharon Competta, who, there she is, who we worked on many projects together in West Haven years ago, and find our paths crossing again. So I think that happens a lot, right? You find when you're women, your paths cross again and you get the opportunity to work together. So I'm glad that you are a part of this project. Glad to connect again. Okay, without further ado, then I'm going to introduce Jennifer Stedman, who is the Executive Director of the Aurora Women and Girls Foundation. And I want to hand it over to you, and you take it away, Jennifer.
Great, thank you so much, Representative Borer. We're really thrilled with the opportunity to present essential equity to the members of the Women's Caucus. We're just so grateful that you recognize how important this information is, and that we can all work together to ensure a better recovery for all of Connecticut, particularly for women and girls. So it's my job to sort of give you a little overview of how the presentation will go today. So I'm going to start with a brief summary of the report and the collaborative effort behind it. And then we'll share a companion piece, the Women and Girls Data Platform, that it offers an additional source of data on women and girls. And then we'll hear from community partners who we worked with to offer policy recommendations for each section of the report. So as we said, we'll leave plenty of time for questions at the end, and you can go ahead and post those in the chat as we go. We rolled out the report last week with a pretty tremendous event. We had about 200 people there that included really moving testimony from women impacted by the data that we'll share today. So as a follow-up to today, we'll send out a link to that recording in case folks would like to know more. So what was the motivation behind the report Essential Equity? As advocates for women and girls, we knew that systems of sexism and racism already disadvantaged women and girls, and we braced ourselves for how the COVID-19 economic and health crisis would further harm them. This report documents that harm. Essential Equity shows the disproportionate impact of COVID-19 on women, and particularly on women of color, across areas of health, economic security, childcare, housing, mental health, safety, and hunger. This is some of what Connecticut women are facing. Women are contracting COVID-19 and dying from it at higher rates than men. 54% of COVID cases were women. Black and Hispanic populations have higher case and death rates than white populations. Women are struggling to feed themselves and their families. There was a 300% increase in applications for the food assistance program SNAP. Women aren't safe in their homes. The Safe Connect domestic violence hotline saw a 30% increase in calls. The report also highlights that effective economic recovery will not be possible without strong participation from women. 49% of Connecticut's workforce is female, and 48% of those women serve in essential jobs or are classified as essential workers. For the first time in Connecticut's history, unemployment claims by women outpaced those by men, and that has held true throughout the pandemic. We've measured the negative impact of COVID-19 so that we can begin to address it with significant investments in caregiving, healthcare, housing, and education and job training to provide relief and recovery that meets the need. Without childcare and paths to careers with family-sustaining wages, women will not have economic security, and the larger Connecticut economy will not improve. Essential Equity is the result of an amazing collaborative effort by women's funds across the state, women and girls serving organizations, state agencies, and many others. The report was made possible by funding from women's funds across Connecticut. And they included the Aurora Women and Girls Foundation, the Community Fund for Women and Girls of the Community Foundation for Greater New Haven, the Fund for Women and Girls of Fairfield County's Community Foundation, the Northwest Connecticut Community Foundation in honor of its Women and Girls Fund, the Women and Girls Funds of the Community Foundation of Eastern Connecticut. And you'll hear from many of the community partners today who joined us in developing particularly the policy recommendations that you'll see in this report. Those included the Connecticut Collective for Women and Girls, QUELF, or the Connecticut Women's Education and Legal Fund, the Sari A. Rosenbaum Fund for Women and Girls of the Middlesex County Community Foundation, the Village for Children and Families, Health Equity Solutions, End Hunger Connecticut, Connecticut Coalition Against Domestic Violence, Connecticut Fair Housing Center, and the Connecticut Early Childhood Alliance. And then there was the amazing group for our report advisory committee that I was so pleased to chair. These women gave up many hours over the fall to put this report together. Sharon Capetta, Tricia Hyacinth, Julie Scharnberg, Thayer Talbot, Lauren Parda, Carla Fortunato, Kara Strawn, Michelle Reardon-Nold, and Maddie Granato. I'd like to thank Marie McNamara for her technical support this afternoon. This report would not exist without the outstanding efforts of the Connecticut Data Collaborative. The CT data team of Elizabeth Grimm, Jason Chung, and Michelle Reardon-Nold collected the data and analyzed it, all in the middle of a pandemic. I'm pleased to introduce CT Data's Executive Director, Michelle Reardon-Nold, to talk about the Women and Girls Data Platform, a companion resource to essential equity.
Whoop, I forgot to unmute. After 10 months, I'm still trying to remember to unmute. I'm Michelle Reardon-Nold. I'm the Executive Director of the Connecticut Data Collaborative, and it's my pleasure to be here this afternoon and share the report and the findings, and also the policy recommendations, in addition to this data platform that we built in conjunction with this report. The Connecticut Women and Girls Data Platform was launched in 2019, and recently, in conjunction with the report, we updated it with new data. And it's a resource for finding state level data as well as county data and data for our big cities on women and girls. We have demographic information, health and safety, education, economic security, civic participation, mental health, substance abuse, justice, and housing data. So I encourage all of you, if you're looking for data, to visit the site. And if you have any questions, please feel free to reach out. Happy to help and be a resource as you all do your hard work of representing Connecticut. So thank you.
Good afternoon. So my name is Samantha Liu. I am the policy analyst and advocacy specialist for Health Equity Solutions. Thank you so much for your time this afternoon. So Health Equity Solutions is a statewide nonprofit focused on promoting policies, programs, and practices that result in equitable healthcare access, delivery, and outcomes for all people in our state. People of color in Connecticut faced wide disparities in health before the current crisis. The widening of these disparities is likely as these communities will bear a disproportionate share of the burden of both disease and efforts to contain its spread. By centering the needs of people who face extraordinary social and economic barriers to accessing healthcare as well as basic needs, we can prevent unnecessary hardships. So the report today highlights vast inequities in our health system. Black and Hispanic residents saw the disproportionate shares of infection, in part because of systemic inequities due to higher likelihood of working in essential worker roles, living in more densely populated homes and neighborhoods, and having underlying conditions. The inequities in our state are not new, and it's time that we implement proven pathways to addressing them. So with that, we recommend restoring the Husky A eligibility limit for parents to 1% of the federal poverty level. Husky programs are crucial to affordable healthcare for lower income families, because even subsidized private insurance means thousands in out-of-pocket costs, as well as having insurance decreases risk of medical debt and avoidance of care, and increases opportunities to stay healthy and catch illnesses before it gets worse. Second, we recommend solidifying equity-focused telehealth by ensuring long-term extensions of telehealth addresses the digital divide and meets the needs of communities of color in our state. As the pandemic continues for months and possibly years, telehealth data collection now could lead to system-wide improvements, as well as mitigating long-term inequities. And then lastly, we recommend recognizing racism as a public health crisis. This is the first step in intentionally embedding health equity in policymaking. The path to building equity in our state is not a blank slate, but rather a clearly marked roadmap of proven policies. So we really appreciate your collective leadership in addressing the pandemic and its impact on the majority of Connecticut residents today. If we can be of any further support, please don't hesitate to reach out. Thank you so much. And with that, I'm going to pass it on to Maddie Granado from the Women's Education and Legal Fund.
Great, thank you, Sam. Hi, everyone. My name is Maddie Granado, and I'm the Policy Director for the Connecticut Women's Education and Legal Fund, or QWELF. Caucus is a statewide nonprofit organization that advocates for and empowers women and girls in our state, especially those who are underserved or marginalized. We serve as the convener for the Connecticut Collective for Women and Girls, and we're so proud to be a partner on this important report. Essential Equity confirms that women, specifically women of color, have shouldered the most severe impacts of the pandemic, both at work and at home. The report shows that while women comprise 49% of our state's workforce, they make up the majority of occupations most severely impacted by the pandemic, both on the front lines of the crisis and in industries experiencing the highest rates of layoffs. Women make up 78% of the healthcare workforce, 67% of the education workforce, and 56% of accommodation and food service industries. I will also note that these are industries that often do not provide workers with access to paid sick leave, family leave, or a livable wage. The report also illustrates the crisis that women in our state are facing between work and caregiving responsibilities, highlighting the collapse of an already fragile system of care in our state. For example, of Connecticut parents who reported having to stay home and not work due to childcare in the fall of 2020, 76% were women. If even just 1 to 3% of mothers to children under the age of 18 leave the labor force, Connecticut could see a loss of between $150 and $500 million in annual wages for 1 year alone. Those are numbers that could be a lot higher when accounting for lost income or sales tax revenue. The COVID-19 pandemic and its catastrophic impact on women in the workforce highlight the need for access to comprehensive paid family and medical leave and sick days, both of which support women to care for themselves and their families without leaving their jobs or risking their economic security. We recommend that the state continue its implementation of its landmark paid family and medical leave program without delay so that eligible workers can begin to receive benefits early next year. We also recommend amending Connecticut's paid sick days law to ensure that all workers are covered and have access to the short-term paid time that they need, regardless of their employer or their job title. The state should also continue on its path to raise the minimum wage, which will directly impact women, specifically women of color, who are overrepresented in low-wage jobs. Finally, we recommend that the state invest in job training programs and educational opportunities that truly center the experience of women and the unique barriers that they may face to advancing in the workforce. Next slide, please. Essential Equity puts data and numbers behind the term she-cession, or an economic downturn where job and income losses are affecting women significantly more than men. The report illustrates that since the beginning of the pandemic, women have filed the majority of initial and continuing unemployment claims. And it's also important to note that significantly more women of color have experienced loss of income than white women, and more than 1 in 3 of initial unemployment claims filed by women were by women of color. Without significant and intentional action, the impact of the pandemic on women in our state could have profound economic implications, both in the short and the long term, potentially taking decades to reverse. In addition to the recommendations of the previous slide, CULB also urges the legislature to advance policies that close racial and gender wage gaps that prevent women, especially women of color, from paying off their student loans, from affording rent, buying groceries, and contributing to the economy. We support legislation this year to increase pay transparency by requiring employers to provide salary ranges for vacant positions. And we also support the leadership of advocates, including the YWCA of Hartford, in pushing for passage of the Crown Act, which will prohibit discrimination based on hairstyle, texture, or type. The legislature should also play an active role in supporting equitable pathways for women to high-wage, high-growth jobs, as well as study and address, again, the barriers that they may face to obtaining and keeping stable, well-paid employment. As Jenny said, economic recovery will not be possible without strong participation by women. We urge lawmakers to put the data presented in Essential Equity to action this year to ensure that our state's recovery from the pandemic centers the needs of women, especially women of color, and leads to true structural change that challenges the status quo and combats our state's vast gender and racial inequities. Thank you so much, and I'll pass it to Meryl Gay from the Connecticut Early Childhood Alliance. Thank you.
Thank you. I'm honored to be invited to speak here today. The childcare industry has been hit particularly hard by the pandemic. Many programs followed the lead of the public schools and closed initially in March, making it difficult for lots of parents. As programs started to reopen, they did so with smaller group sizes and with many parents reluctant to bring their children back. That's created serious economic hardship for childcare providers across the state. We have lost about 30% of our original capacity to provide care. And then in September, when schools went back into session, with many of them remote or hybrid, there was another entirely new childcare problem, and that's all the kids who normally would have been in school who were not attending in person. That created another childcare crisis because no families have money to pay for childcare in their budgets for kids who are normally in public school. So now we have a weakened childcare industry trying to hang on through this. Providers spending much more money than they ever had to on cleaning supplies and PPE, and still trying to do things like to keep children and staff safe by keeping groups together, which prevents them from doing one of the things they almost always did before, which was to collapse groups at the beginning and the end of the day so that they could minimize staff expenses. The childcare industry has always had what's sometimes called the trilemma, that it costs too much for parents, there isn't enough of it, and it doesn't pay well enough for the people who work in childcare to make it a long-term career. We know the importance of high quality childcare and early learning programs in children's brain development. And yet this is something that most families can't really afford, particularly infant toddler care. Children of color, their families are really not able to afford high quality care. 94% of them are not able to afford care. And that's why we have such a huge shortage of infant toddler care. That shortage is estimated at 50,000 slots. That was pre-pandemic. It's only gotten worse since then. This is a big contributor to the she-cession because mothers still have the vast majority of child care or child rearing responsibilities in the home. And when parents can't afford childcare, it's typically mom who takes time off from working, which jeopardizes her Social Security earnings, as well as just creating a hardship for families as far as family earnings.
Excuse me, Meryl, could you speak up just a little bit?
Sure.
People are having a hard time hearing you.
Sorry. So our recommendations for how we address this are to beef up the Care for Kids child care subsidy program. We've been working with child care providers in speaking with our members of Congress, and fortunately there was some money that came through in the last stimulus, but getting us back to where we were before is not good enough. We had a real problem with childcare in this state beforehand, and it's time that we think bigger about how do we make childcare affordable for families? How do we make it a profession that people can work in and hone their skills to provide high quality care for families? And how do we make sure that when we do that, we are honoring parents' desires to have a mixed delivery system so that they can choose where they're putting their youngster, whether it's close to work or close to home, whether it's in a family child care or it's in a center or it's in a public school. But we want to make all of those options available for the spectrum of childcare needs from birth through school age care up to age 12. So some of the things that are particular problems now is that Connecticut has one of the more restrictive eligibility rules for Care for Kids. You have to be working. You are not able to be in a job training program or going to school to make it possible to get a better paying job. Those are things we would like to change. We also think it's really important that we help out the childcare industry now with the immediate issues of providing adequate wages and PPE and cleaning supplies to get them through the pandemic. We are working with legislators and community partners at building a plan to move towards universal childcare. And I just want to raise up that Representatives Comey, Simmons, and Farrar have introduced a study bill to look at that. That's a really important step in the right direction to solving this she-cession, is to make childcare available so that parents can go back to work. And now I have the joy of introducing somebody whose name I'm sure that I'm going to, I've never pronounced this name before.
Nuala.
Okay, I'll let you introduce yourself.
It's a common problem with very Irish names. Good afternoon, everybody. I just want to take a moment to thank Representative Barr and Representative Rimbus and the Aurora Foundation for this opportunity to speak with you all today. And I'm just really impressed with the value of this report. But if I could echo one of the sentiments that Meryl just said, was that it is an opportunity right now to think bigger about these problems. And the data that I am going to present to you and that my colleagues have presented before me and that will present after me could be mitigated if we truly were committed to the passage of anti-racist policy, and if we were really committed to making sure that we were centering race as the beginning and the foundation of every single recovery effort, right? So there is possibility if we're prepared to engage in that think bigger stance. So I just want to spend a minute providing some context before I get into the recommendations of the Fair Housing Center. So between March 10th and now, there has been 3,169 evictions filed in Connecticut's courts. There has been 861 executions issued, which means 861 families have been moved out of their homes, despite current eviction moratoria. Evictions hit communities of color the hardest because of who rents their homes in Connecticut and where they rent their homes. 43% of Latino families and 45% of Black families report that they have little or no confidence in their ability to pay next month's rent, and that's on the most recent Pulse survey data. In addition to this, 64% of Black and African American families rent their homes. 61% of Latinx families rent their homes, in comparison to only 34% of white families. So when we are on the precipice of an eviction tsunami, it is without a doubt that people of color will be overrepresented on the dockets, right? So the other thing to realize in all of this is that the public cost of evictions in Connecticut alone, this is not a national number, but in Connecticut alone, the public cost of the impending eviction crisis is going to be estimated at about $1.2 billion, right? That's costs for judicial, that's costs for entry into the homeless system, and that's social service costs. Additionally, data is suggesting that eviction moratorias and solutions to promote housing stability actually reduce the risk of or reduce the infection rates of COVID. So the most recent one suggested that eviction moratoria reduced the spread of COVID by 3.8%, but reduced fatalities of COVID by 11%. Meaningful eviction moratoria without exceptions, right, which is not what Connecticut currently has, can help reduce the spread of COVID, help reduce the fatality rates of COVID-19, and in addition, increase the housing stability specifically for people who rent their homes, which in Connecticut is overwhelmingly families of color. And so we would really charge the legislature to extend the eviction moratorium until the end of this crisis. Now, we know we have public money, federal money coming in for rental relief, but it has been made clear by the past that it is very challenging to get that money out the door and to get it out the door in a timely fashion. And so it's imperative that we extend this eviction moratoria until the end of this crisis. We also are advocating hard for the need to cancel rental arrearages. So my rough estimates are that we have about $500 million in rental arrearages in the state of Connecticut, and there is simply no pot of money big enough to cover those arrears, right? It's such a wildly large amount of money that there's no program that's going to cover it. And using federal money to pay off arrearages does not preserve housing stability, and it does not reduce the spread of COVID. Additionally, what we have learned in this crisis is that families with a subsidy, right, either in place or a housing choice voucher, have had a higher ability to preserve their housing stability during this crisis because their subsidy is related to their earnings. And so we would also advocate and are recommending for the increase in federal housing choice vouchers and increase the access to those federal housing choice vouchers. I'm going to put my email and the link to our website in the chat, and I'm happy to take questions. And I'm going to pass it on to Yvette Young with the Village for Families and Children.
Hello, everyone. Thank you so much for inviting me to be a part of this conversation and to be able to advocate for the need for telehealth services for mental health needs. So I work at the Village for Families and Children, and the Village is a nonprofit behavioral health organization who for over 200 years has been dedicated to building a community of strong, healthy families who protect and nurture children. At the Village, we meet children, adults, and families from all walks of life whose unique sets of challenges are best assessed, treated, and supported through a holistic, individualized approach. The Village was recently designated as a certified community behavioral health clinic, which is now creating more access to underserved communities. In 2020, the Village served close to 20,000 people. Over 10,000 of those individuals received behavioral health services. 53% of all clients served were female. Due to the COVID pandemic, the Village closed on March 17th. Within 1 week, we were able to provide services to 53% of our clients through telehealth. By the end of April, we had increased telehealth services to 93% of those clients in need of mental health services. During this time, the volume of client engagement increased by 14%. Currently, 62% of people receiving behavioral health services to the Village are women, the majority of which are Black and Latin women. So definitely a skew towards a disproportionality for who is seeking services, as you see in the data on this slide. The majority of our clients received telehealth services in 2020. We had a 25% increase in the number of clients served in 2020, indicating obviously that telehealth services opened up access to more individuals. And so we saw more clients than we had in the previous year. Our data aligns with the data shared in the Essential Equity Report. We also experienced an increase in the number of referrals for domestic violence, substance abuse, depression, and anxiety. This increase is a result of the isolation that was induced by COVID, job losses, economic instability, food insecurity, and fear of dying from the virus. We have all been managing more stress than normal. Our data indicates that telehealth services work and provides more access for mental health treatment. Telehealth services mitigates transportation and childcare issues, especially for women who are seeking services, who are working and have children. It gives women an opportunity to prioritize their mental health needs. When people and women specifically needed support, telehealth services allowed the Village to provide that needed support. The data clearly indicates that there is a need to extend and expand access to telehealth to create access to mental and physical health services for women and girls. It is also important that we address the digital divide that exists in order for us to meet the needs of people of color, as indicated is accessing mental health services at a higher rate than their counterparts. As COVID-19 continues to have a major impact on the mental and physical health of our citizens, it is imperative that we provide them with the supports they need. And telehealth is one of those supports. So I ask that you support and advocate for that expansion. Thank you. And I'll turn it on over to Liza Andrews from CCADV.
Thanks, Yvette. Hi, I'm Liza Andrews. I'm the Director of Public Policy and Communications at CCADV. I think, from the onset of the pandemic, there was a rapid transition to remote advocacy by over 400 advocates across the state as CCADV's 18-member organizations, and at Safe Connect, that is run out of CCADV and serves as the state's domestic violence resource hub and centralized hotline. Advocates worked tirelessly to ensure that services remain functional 24/7 throughout the pandemic. There were quick adjustments to shelter settings to ensure adherence to social distancing guidelines, a significant amount of proactive outreach to existing clients to try to get ahead of their potential needs during the pandemic, and also the work that CCADV did with our partners at Connecticut Legal Services and the judicial branch to ensure that restraining orders were still accessible throughout the pandemic, which was achieved through an executive order issued by the governor in April. Throughout the pandemic, we have seen an increase in the complexity of issues for which victims and survivors contact us. Certainly many aspects of an abusive relationship are compounded by the dynamics of a global pandemic. A pandemic limits options for everyone, but this can be felt even more acutely by victims and survivors who are already dealing with control and limited options in their lives. Definitely one of the big issues that arose during the pandemic for our service system has been the substantial increase in the need to utilize hoteling for survivors. I already mentioned the need to socially distance and maintain, proper social distance guidelines in our shelters. Our shelters normally run over capacity for the past several years. They've been over 120 throughout the year. But with the pandemic, we had to limit how we could account for that in shelter with things like doubling up, using extra rooms to put additional families in. So that has meant hoteling more survivors and their children to keep them safe. Between March and December, our 18-member organizations spent close to $600,000 in unanticipated hotel costs to keep families safe. Our CEO worked diligently through the summer and fall to secure additional funding, which has included private philanthropic dollars to serve as a match to access additional FEMA dollars through DSS. That did take some time in the process with DSS to access the FEMA funding was just finalized in January. So CCADV can now begin reimbursing our member organizations for the hotel costs. In terms of how the money we have secured so far, how far it will take us, there's a lot we can't predict, obviously, about the future of this pandemic. But what we do know is that there have already been other costs related to the increase in hoteling that goes beyond the physical space in hotels that really hasn't been accounted for at this point. So that's providing 3 meals a day to families staying in these hotel rooms, providing laptops to children so that they can do remote learning from the hotel, paying for the Wi-Fi at the hotel, and then the increased staff time to manage the hoteling. And then even once vaccines are widely available, we imagine that our shelters will need to remain socially distanced at least through the end of this calendar year. The domestic violence service system was already stressed before the pandemic began. So certainly some other things, all the things you've already heard about from the other speakers today will help survivors gain the safety and stability they need. Financial limitations are often the #1 reason that victims remain in abusive relationships. Their inability to leave because they don't have the financial independence to do so. So a lot of the things that will help survivors long-term: affordable housing, education, job training, pay equity, access to affordable childcare all help survivors gain financial independence. And of course, legal representation. The court system is also stressed, and a lot of that is with victims of family violence who are going it alone, pro se, in their child custody and divorce cases. So all of these things will help survivors long term. So with that, I will turn it over to Robin at End Hunger.
You'd think I would know to have my unmute button ready. Hello, everybody. My name is Robin Lamont Sparks. I'm the Executive Director of End Hunger Connecticut. We're the only statewide food insecurity organization that's fighting to ensure all our families, friends, neighbors, and children have enough healthy, nutritious food every day. And we know right now that our families are hurting. This pandemic has caused unprecedented hunger. People who've never had to use the emergency food safety net have had to access it. And pantries have been overwhelmed. All you need to do is turn on the TV anytime, and you can see pictures of drive-up distributions because food is the one thing people can get for free. It also has highlighted the importance of school meals for feeding children. The school meals program has been invaluable to many of our families because it's helped them stretch their budgets and ensure that their children do have enough to eat during this pandemic. And kudos to our school food service workers who've risen to the challenge to continue feeding children this entire time. But what we know is SNAP is our best line of defense to hunger. Right now, well, and many studies have shown that for every dollar in SNAP benefits, it generates $1.80 in local economic activity. Studies have shown that, and we really push for increased SNAP benefits. We run a SNAP call center, which helps anybody who needs assistance on SNAP applications or other questions they may have about the program. Before the pandemic, we received about 450 calls a month for SNAP assistance and other questions. Last March, the beginning of the pandemic, we received 2,000 calls. By August, we were receiving 100 calls a day. And just this last December, things have started to slow down a little bit, but not much. December is notoriously a slow month for us in the call center, and we received 4,500 calls. Of the adult households who've called, almost half were female and over half were Black and Hispanic. But in our households with children, almost 90% of the phone calls came from women, and approximately 2/3 were Black and Hispanic. Since this report was compiled, lots of action on federal policy has happened regarding hunger. And in many ways, it's really good news. For instance, 15% increase in SNAP was included in the omnibus appropriations bill right at the end of the year. And DSS has already been able to get that out the door. 2 regulations that would have severely reduced benefits and recipients of benefits were withdrawn. They were withdrawn right at the beginning of the month, and they would really have impacted Connecticut worse than many other states. And there's already been good news with this new administration. I was fortunate to be on a White House briefing call last Friday with hunger advocates from across the country. And the second gentleman actually kicked off the whole meeting, stating that hunger and fighting hunger is going to be one of his major causes. In addition, a hunger advocate has been installed to run the USDA Food and Nutrition Services program. Initial executive orders have been issued. The pandemic EBT program, which has been critical for families, will now include funds for snacks. Connecticut is hoping to have their application out the door this week or next, and hopefully we'll be able to get that approval quickly and get those benefits to children. We had them last year at the end of the school year. This one will go for this whole school year. In addition, the new guidance, which just came out on Friday, finally explains how to get the SNAP benefits for children under 5 who receive SNAP. They'll now be deemed to have been in childcare and will be able to receive pandemic EBT benefits. They've also made an executive order to increase the emergency allotment for those who are already receiving the maximum benefit. Before, the emergency allotment only it made sure everybody was at the maximum. But those who are at the maximum, who many times may be women, single women with children, did not see an increase. This administration wants to make sure that that happens. And they're also going to look at the formula that's used as the basis of the benefit level. It's much more expensive to live here than in other parts of the country. And, increasing that benefit because of the way they calculate it will be a really big win for us. And then today, President Biden issued an executive order directing federal agencies to review the public charge immigration policy and other policies that have stood in the way of immigrants and families from accessing public benefits. In addition, the plan that has been introduced by the president would extend the 15% increase in SNAP from June to September and try to tie it to some economic and health indicators so that we don't worry about when it runs out until this country is through the pandemic. It also increases investments in WIC, the the program for women, infant, and children. That program is really, really beneficial to many of our families, and seeing an increase in that will be helpful. And also some administrative support for our programs here in the state, because they have been working long, long hours, just like all of us in Hunger, trying to deal with all these different waivers and everything else that have had to go on to get benefits out the door. So many of these programs that have to deal with Hunger are federal, but there's a couple things that I think we could do here in the state, which would be great. One of them is that I would urge the legislature to look at expanding the program, expanding the Universal School Meals program, which we have right now. Anybody can get a meal, to expand the program throughout the year. Our neighbors in Vermont and Massachusetts are looking at that, regardless of what the federal efforts will be on expanding the program. And I think also encouraging increased cooperation amongst our friends at WIC, Husky, and SNAP to identify children who may not be receiving all the benefits for which they qualify. We have the data, but too often we still work in silos in the state. COVID has truly exposed the economic fragility of many of our families, and I'm hopeful that the crisis will be the impetus to make real change happen, boosting direct supports to families, fostering new cooperation among organizations, and increasing coordination of government programs here in Connecticut, because no one should have to depend on the kindness of strangers to feed their children. And with that, I'll turn this over back to Jennifer Stedman.
Thanks so much. So I want to thank all of our fabulous presenters today. We really relied on your expertise to think about how to turn the data that we presented into actionable recommendations. So we have a few questions in the chat that I thought I would, so I'll read them out, and then maybe we can people can either chime in or use the hand raiser or whatever. Christine Palm asked, I think this question is probably for Finn. Has anyone suggested simply giving the rental assistance funds directly to the landlords with the strict proviso that they not begin eviction proceedings? Seems more streamlined.
Christine, great question. So all rental assistance, even pre-pandemic, always went directly to a housing provider. Think about like your Section 8 subsidies, right? The landlord always received the funds, that they did not go to the tenant, even if the tenant applied for funds. Currently, the debate in the disbursement of federal money is that promise not to evict, right? So it's still under debate. Obviously, advocates for housing stability and advocates for the reduction of the spread of COVID-19 are advocating very hard for that promise to not evict once they receive funds. The other thing that's really interesting in this debate is that there's this cry of well, what are we going to do for the landlords? Well, what are we going to do for the landlords? Well, what are we going to do for the landlords? And I just can't help but wonder that if you provide a tenant with 12 months rental assistance, that's rent for the landlord. Like, by preserving the tenant, you preserve the landlord, right? So I find that language, that rhetoric, to be a little bit interesting.
Ben, may I just ask a follow-up? If that's the case, and I of course don't for a minute doubt your expertise, why are landlords telling us that they are struggling, and why are these eviction proceedings going ahead if they're getting the money directly, or is the holdup getting the money to the landlords?
So the eviction stats that I read at the beginning of our presentation are because there are 4 exceptions to the state's current eviction moratoria, and that is how housing providers right now are still able to evict their tenants. It is not only for non-payment of rent, and I'm happy to talk offline, but the evictions are nuanced and long, so I don't want to take everybody's time, but the evictions do permit, or the exceptions do permit evictions to go forward. One of the reasons I think housing providers are suggesting that they're having a hard time is they're not even aware of the resources that are available to them. So housing providers have access to mortgage forbearance. If they have subsidized mortgages, they have access to mortgage forbearance for over a year. They also have been given state preservation dollars to forbear taxes, like real estate taxes, in addition to a well-funded emergency mortgage assistance program, right? So my assumption is that they're just not accessing the resources that they have. But as an advocate for tenants, I can't necessarily speak to what they are and are not doing.
Thank you.
We did get information on the Child Care Task Force bill number that Meryl spoke about, and that is HB 5766. And we'll include all the information from the chat in the email that we send everybody, so you don't have to worry about that too much. And then there was also Representative Foster pointed out that HB 5678 is a bill to streamline federal commodity food access. All right, does anyone else have any other questions?
And it looks like Robin Porter does. You can unmute yourself if you'd like.
Thank you. Just a quick question to follow up on the housing. So are you saying that it's possible that landlords are actually getting paid and still evicting people?
No. So there's 4 exceptions to the current moratoria. One of them is for serious non-payment, and serious non-payment is if somebody has not made any rental payments in the past 6 months. The other exceptions are long and nuanced, and so I'm happy to talk offline, Representative Porter, if you would like to about those. But there are exceptions, which is why they are permitted to evict. It's not always related to non-payment.
Okay, thank you.
Jennifer, I had a question. I had a couple questions. I'm looking to see, I think the speaker was Robin on the recommendation that the agencies work more collaboratively. So I think, I'm not sure, did you make a full presentation to the Governor's Women? I know you touched upon it at the Governor's Women and Girls Council, your report. I don't know if you shared all the details, Jennifer, of the entire report. I'm just wondering, because that's an interagency council that with a mission to work collaboratively, to support women and girls. And I'm just wondering what their position was on that.
I talked to Cherie about that possibility, and that didn't work out. We announced that the report was coming, but I'll follow up with her and see if that might be a possibility.
Yeah, because that's one of their roles. They have the commissioners of all the agencies work together to figure out how they could streamline, and I think they could probably be really helpful in that aspect.
And they were super helpful actually in gathering the data. So they connected us with lots of the different agencies and commissioners.
That's great. And then just one other, 2 other follow-ups. I didn't hear you mention 211, the United Way program. Did you gather data from 211? I thought I remember reading somewhere that one of their top reasons for calls is housing. Did you get information from them as well?
I'm going to turn that one over to Michelle Reardon-Nold because we did, but she's the data lady.
Yes, we did. We did get 211 data, and I remember off the top of my head what the highest percentage is, but that sounds about right. Housing and food insecurity and mental health ring bells in terms of like the highest categories of calls. Definitely housing in terms of highest, but I would be happy to follow up with you with more specifics.
Yeah,
it is in the report. They were very helpful in disaggregating the data and also providing it by gender, who more women are calling 211 for help than men.
Yeah, that'd be great data to share with the group on because I know their call volume, expanded incredibly, like the service needs did. But if we could get data from 211, and we could reach out to United Way as well, but if you could help with that, that would be great. And then one last question, and then I'll turn it back over. One of the earlier speakers mentioned a recommendation about salary ranges. I missed that part. What did we, salary ranges would help in what aspect?
Maddie, I think that was you.
Yeah, thank you. Thank you. Hi, thanks Representative Bora for that question. We really, at Qualvin, thank you too to the leadership of the labor chairs, Representative Porter, I know you, for raising this issue. We really see it as the next step that Connecticut can take towards closing the gender wage gap. Right, in 2018, we passed legislation to prohibit employers from asking of an applicant's prior salary, which was a very important step. And then we see this as kind of the next step in the continuum, right, to close the gap in our state. It just, it increases transparency. It, assists workers or applicants in the negotiation process. We know that women and people of color are paid less than men, and white men specifically. And if you are already paid less in your previous job, and you're expected to, negotiate a salary that is 10 to 20% higher than what you made in your previous job, you're already starting off from a lower point. So we just really see this as a way to increase transparency. We can encourage women and people of color to negotiate all we want, but if we're not also, encouraging employers to be transparent about what they can pay, that's the way that we move forward. So I can definitely send you some more information on that. We have a fact sheet. So yeah, and Representative Porter,
I'm sure Representative Porter too, as well, would probably already working on that. Maybe the committee will take a second look at that, I'm sure. Well, thank you. Those are all the questions I have. I don't know if there's more questions before we.
I see it. One hand raised.
I do. Okay. Carol.
I see Carol Williams. You just need to unmute yourself. Sorry.
I'm sorry. I didn't mean to raise my hand. That was an accident.
Oh.
Thank you.
And Michelle has put some of the 211 data in the chat, Representative Borer. So
that'd be great.
It's in the chat, and we'll make sure to include that in the follow-up email too.
That's great. We're concluding right on time too. You had that down to a science, this presentation, but I know everybody who has joined us here today is very thankful for all of the work that you've all done and the collaboration that you've done to bring all of this information, not just to our attention, but to the residents of Connecticut. So we've all felt the impact. We know that, there are women and girls of color that have felt the impact in an extraordinary fashion, and whatever we can do to help to support. We're certainly going to look at the policy recommendations and talk about them as a caucus and see what we can support. And I know there's going to be more to come and more great collaborations from your organization. So thank you again. And if there's anything you need, from any of our members, just reach out to myself or Rosa. And I know we will put you in contact with specific legislators who are chairs of committees of cognizance that will help you as well. And just want to thank you again. Thanks, everybody.
Thank you.